A cause of diffuse pulmonary edema in a newborn with a normal size heart, one has to consider the possibility of abnormal venous drainage of the two lungs. This frontal chest rentgenogram revealed a normal size heart, no evidence of murmurs, diffuse pulmonary edema, and some prominent vasculature. A late phase of a pulmonary arteriogram shows evidence of infradiaphragmatic venous drainage. You can see a common vein directed towards the abdomen, and you can see that this vein connects with the two lungs. This vein can terminate in the portal system or in the inferior vena cava. And the junction of this vein with a systemic vein may be normal or may be narrowed. Even without the narrowing, venous hypertension results, and that explains the pulmonary edema with non-enlargement of the heart and no evidence of cardiac murmur. A lateral projection of the venous face of the pulmonary arteriogram shows the common pulmonary vein connecting to the portal vein. So this is a classic example of total anomalous pulmonary venous return below the diaphragm, where the common vein drain into the portal system. This is a specimen of a total anomalous pulmonary venous return below the diaphragm. Note the common pulmonary vein terminating in the portal vein. This patient had also an anomalous pulmonary venous return. Note signs of pulmonary edema, particularly in the central portion of the lungs, in the presence of a non-enlarged heart. But in this case, there was atresia of the common pulmonary vein. This is a histological section of the lung showing dilated pulmonary lymphatics. What usually happens is that the drainage of the lungs is towards the pulmonary veins or via the lymphatics. If one has obstruction of the venous system of the lungs, then interstitial and intraalveolar fluid will find its way into the lymphatic system, and dilated lymphatics will be observed. The dilation of the lymphatic system can be so prominent that congenital pulmonary lymphangiectasias of the lung often have been diagnosed when actually the primary process has been in the pulmonary veins. In this patient with also anomalous pulmonary venous drainage, we can see thickened interlobular septa where dilated veins and lymphatics are observed. In this particular photograph, we can see that the lymphatics appear larger than the pulmonary veins.